Hi there, this is Dr. John Carrozzella from the Florida Center for Hormones and Wellness. And I wanted to talk to you for a couple of minutes today about this question that I hear almost every day. That is, Doc, are these hormones safe? Well, I can unequivocally tell you that beyond any shadow of a doubt, that biologically identical hormone therapy is not only safe, but it's highly effective, and it's absolutely essential to maintain a vital, active quality of life through the aging process. So a lot of you may have heard that hormones cause some problem or another, from cancer to heart disease to blood clots to whatever. All of this is not applicable directly to biologically identical hormone therapy. And by that I mean, when you look at hormones, hormones are either the natural form that exists in your body or they may be synthetic. And while we do indeed manufacture the biologically identical hormones, they're exactly that. They're biologically identical. That means they are exact copies of the hormones in your body. That is, they do exactly what the hormones in your body do. So restoring them, it seems intuitively to be a natural, normal, healthy process. That is, as opposed to a drug or a synthetic hormone which is put into your body, it is made for a specific purpose. And the body may not recognize it as a natural substance, and it may metabolize it in a way that many times can lead to a side effect. So when you look at the studies and the outcome studies as they relate to the synthetic hormones, we in fact indeed do see that these substances can cause problems. That is, the synthetic hormones can cause blood clots, heart attacks, strokes, and all of the things that you have heard about hormones. The problem is everyday medicine, a lot of the editors over the years in conventional wisdom has conflated the results of these synthetics and tried to apply them to the biologically identical or more natural appearing hormones. That's a real problem, and it largely came about from a study in the early 2000s called the Women's Health Initiative. The Women's Health Initiative looked at two synthetic hormones, one derived from horse urine with a whole lot of foreign estrogens in there that are not directly related or useful in women in terms of natural function. They also used another synthetic hormone called a progestin, not progesterone, not the natural progesterone, called medroxyprogesterone acetate. And when these two hormones were combined, these synthetic hormones were combined, what we found out is that a lot of problems could occur. And in addition, the makeup of the study was lousy. It was older women. It wasn't really the typical women that are going on hormone therapy. And a lot of other complicating issues arose in that study as it got studied over the years and reviewed over the years. And in fact, just recently, there was a great publication in 2023 that looked at the Women's Health Initiative and said basically it's a bunch of garbage. That is, all of the conclusions in there were either not statistically significant, meaning not important scientifically, or not relevant because they don't apply to the natural hormones. It's a great study written by an oncologist named Blooming, and he over the last few years has started to look at these outcome studies that looked at even the synthetics and found that the conclusions that these studies have made are often not completely true or in fact misleading. Now, let's turn our attention to the biologically identical hormones. What we find out is that when you study these very carefully and you isolate the studies regarding biologically identical hormones, you find out that not one single study exists that's done in a proper prospective manner that links any of these so-called natural hormones with any significant adverse outcome that will affect your health or longevity. That is, when these hormones are used in people to restore their function, they don't cause blood clots, they don't cause strokes, they don't cause cancer, they don't cause anything bad at all. In fact, when you look at these studies, they show that many of the things that we thought that the hormones actually caused are actually made better. That is, properly balanced hormone therapy reduces the risk of heart disease. It reduces the risk of stroke. It reduces the risk of dementia. It reduces the risk of osteoporosis. And in fact, properly done, it may even reduce the risk of breast cancer. That, oh my God, Dr. Carrozzella, I thought hormones cause breast cancer. Absolutely not. And you'll find even some studies out there these days that show that women with limited breast cancers who are repaired and replaced to optimal levels of hormones actually have better long-term survival, less recurrences, and when the recurrences do happen in breast cancer, they're not as severe. So overwhelmingly, when you look at the medical literature and study it with a very critical, very discerning eye, what you're going to find out is that there may be lots of problems with the synthetics, that the biologically identical hormones are absolutely safe, effective, and essential for long-term health and vitality. I would use them. I do use them. My family uses them. My staff uses them. And people who understand health and vitality, who don't do their own research, use them. We use them effectively, and we use them with very good results. It's amazing to see some of the men and women who have been on long-term hormone therapy come through this office. And when you compare them to their untreated peers, they're healthy, they're vital, they're active, they're sexually active, they're living their best lives as they get older every day. So it's a myth. Hormones do not cause medically significant problems, and in fact, when they're done properly, they significantly and substantially improve the quality and vitality of your life. This is Dr. John Carrozzella from the Florida Center of Hormones and Wellness.